Okay, hello to everyone from different parts of the world. I am Sabreet, the head trainer at Khaira Education, and on behalf of my team, I welcome you all to this all-star session with Khaira Education. Khaira Education is Asia's first premium preparation provider. We have been training healthcare professionals from all parts of the world to pass the test and reach their destination countries and fulfill their dreams. In this, we provide training to nurses, doctors, pharmacists, and physiotherapists. And in this session of OET All Stars, we are going to help you to learn the skill of writing. But before we move on to that, I would like to mention that Khaira Education is based in northern part of India. We provide training both in online and offline mode. If you want to reach out to us, you can either contact us on the social media platforms like Instagram and Facebook, or you can also reach out to us on the given phone number that must be there on your screen. Uh, Moving on to the topic of discussion for today. In this session, as I mentioned, it's an OET writing session that we have. We learn the skill of signposting. As it is mentioned on your screen, signposting is a way of improving clarity in the letters. Um, and why is it so important to have clarity in the letters is the first thing that we all need to be aware about. As you know, that OET has a set criteria against which all your letters are assessed. So it is important that when you're writing the letter, you be aware of the criteria against which the letters are assessed. One of the criteria, one of the criteria is called conciseness and clarity, under which the assessors check whether the information that is provided is clear for the reader and is easily understandable for the reader or not. In order to score better in that criterion, it is important that we learn the skill of signposting that we are going to learn in today's class. But before we do that, I have a small task for you. I want you to look at this patient leaflet that is on your screen. This leaflet has an aim to give information to the patient. You have the same information presented in two ways. On your left hand side, you have some headings, some small topic settings under which you have the information given. And on the right hand side, you have certain paragraphs in which the information is. And keep in mind that this is a leaflet, not a letter that you're writing. So when this information leaflet is given to the patient, as a patient, what do you think would be better or clearer for the patient to understand? The left hand side one or the right hand side? I'll give you all around 3 minutes to read this leaflet or to skim through the leaflet at least and identify which one would be better for the patient to understand, clearer for the patient to understand. And your 3 minutes begin now. Okay, I see some responses already popping in. Amazing. Uh-huh. I see majority of you going with the left side. Okay. Dr. Yalpa, Pooja, Dr. Ritvika, Dr. Imtiaz, Tenzin, Hiteshwari, Niti. You all believe it's the left side. Sarabjeet, Arjun, Sakshi, Pachipo, Neha, Janatri. Okay, great, great. I can see majority of you going with the left side. Uh-huh. All right. Pooja, Tarun, Isha, Bindu, Kuldeep, Shahrukh, Gagandeep, all of you. Okay. I mean, it's not even the majority. I can see all of you going with the left side. Right. I see most of you have already answered, so I would stop the timer. and rather discuss why the left side is more understandable and clearer for the patient. Although the information provided on both the sides is quite clear, I think I would also agree with all of you. The left side would be more clear for the patient, given the fact that it has words that indicate what information is being provided in that particular section or in that particular part of the leaflet. If we see on the left hand side, we have first the information that it's an overview that we are talking about. And then under the overview heading, we've been given the information that diabetes is a chronic condition characterized by elevated blood sugar levels. So the information about what diabetes is highlighted here. And then it progresses to management and monitoring. And under that as well, we have various sections under which the information is provided. So I absolutely agree with all of you that the left side is more clear or clearer for this patient. Similarly, how in your writing, this is a leaflet, you're going to write a letter in OET. So how in your writing of that letter, you can improve the clarity in the letter and make it more clear for the patient is what we are going to learn in today's class. So the lesson is going to focus on the following topics. First, we are going to learn what is signposting. How do we do that in writing? And how do we, what exactly is the idea of it? Following that, we learn how it is used in writing, and you would also learn the skill of putting it in your letters. We'll also discuss some common signposting phrases that can help us in to be used in our letters. And finally, we'll practice some of the activities so that we all become pro at using signposting in our letters. So to begin with, let's start with what is signposting. Signposting is the process of using signposts. So it's very important that we learn what are signposts. Signpost is a word or a phrase. It can be a single word. For example, if I say additionally, it is directing me to add some information, but it's a single word and it acts as a signpost. Or it can be a phrase in regards to, for example, his lifestyle habits. So in regards to his lifestyle habits is more than a word. So I'm using a phrase, a group of words to signpost to indicate what I'm going to talk about. Signposts help the reader to guide through the content. It becomes very easy for the reader to understand the information that you're giving when they're given an idea on what topic are you going to talk about. If you talk about the daily communication that you have with your friends, family, we don't talk about random topics and just out of the blue. There is always a context about which we talk. And if we are moving from that context to another, from one topic to another, you always make the listener, the person that you're talking to, aware of which topic are you going to now talk about. So it helps, similarly in writing, when you use signposts, it helps the reader understand where the text is now moving to, or which topic are you now heading to. It's just like a roadmap. It always gives you the information about what you're talking now, what you're going to talk further, or what have you already talked. So it relates to all the topics that are there in that particular text. So it connects the text. It makes it one whole unit and does not separate the ideas from one another. That is what the next point mentions. Signposts guide the reader to follow the logic and progression of your ideas. So these are not random ideas that you're putting in the letter. You're talking about one patient. And if you're talking about one patient, there always is going to be connection between the different pieces of information that you're going to give about that patient. So it's important that we connect those ideas about the same patient in the letter so that it's easy for the reader to understand. And if it is easy for the reader to understand, you get good score in the criterion of conciseness and clarity, because that is what is checked under the aspect of clarity in that criterion. So it's very important that you learn how to use signposts. And this process of using signposts is called signposting. Let me take you to an example. Again, you have two paragraphs on your screen. In this case, which paragraph do you think is clearer for the reader to understand Mrs. Leon's information about Mrs. Leon's blood levels? On the left hand side, you have the information. After the surgery was performed, Mrs. Leon became anemic, so 3 units of blood were transfused. She requires monitoring of blood levels. While on the right hand side, under the section B, you have post-operatively, Mrs. Leon became anemic, so 3 units of blood were transfused. Following her discharge, she requires monitoring of her blood levels. I can see the responses popping in. Let's see. Okay. Raman, Tarun, Sakshi, Isha, Vachapu, Jaspreet, Neelam, Harleen, Sasikala, Veena, Geeta, Renu. All of you believe it's B. B. Ashok, Dr. Ritvika, Niti. Great. Yeah, all of you believe it's B. I can see more answers coming in. Jitinder, Varinder, Swazi, Sanjana, Shahrukh, great. Right. Absolutely. The right hand side one, column B, has more clarity for the reader because it has some guiding words which tell what happened at what time or under what circumstances. So it makes it more clear for the reader to understand the time at which that action happened, the circumstances at which that action happened, and hence the reader will absolutely have a better understanding of Mrs. Leon's blood levels under column B. Because we've used the term post-operative. So it clearly on the right hand side as well, you have after the surgery. That would also be absolutely okay. So both which ways it is giving clarity about when that action happened. But when we look at following her discharge, that gives it a better idea on when the blood levels are to be monitored. She requires monitoring of blood levels on the left hand side under column A. There is no clarity when this monitoring is to be done. Is it to be done before the discharge, after the discharge, at home? There is no understanding of that. But when we have the information that it is to be done following her discharge, the reader would know whether it has already been done or is it still to be done. So I agree with all of you. It is column B that's more clear. Absolutely, Isha. Isha says because in this we have clarity, right? As readers, we find it more clear. So if as readers we find it more clear, so as writers, it becomes our responsibility to make it clear for the reader of our writing as well. Okay, great. Thank you for your responses. You all got it correct. Now, let's talk about the common signposting phrases that are used in OET writing. These are categorized under various sections. We are going to learn about each category with certain examples. Let's start with introductory signposts. What are these signposts? These are signposts which help you to set the context of your letter. These help you to begin your letter, or these help you to highlight what the letter is going to be about, so that the reader of the letter is prepared on what they are going to get in the letter. Just like you do in your speaking sessions, you set the context for the listener, for your patient, and you inform them on what the letter, on what the conversation in the 5 minutes of that role play is going to be about. Similarly, in the letter, you introduce the patient as well as you set the stage on what about what the letter is going to be. So some commonly used signposting for introductory signposts are the purpose of this letter. I'm writing this letter to request. So many of you have been writing letters already, and you must be familiar with these phrases. So what do? You, in the beginning itself, you specify what the letter is going to be about, what the reader is going to expect in the whole letter. So the reader has more clarity on what they're going to read in the letter. So the purpose of this letter is to request assessment and further management for Mr. Mark, who is showing signs and symptoms of Horner's syndrome. So you're specifying to the reader that this letter is going to deal about the signs and symptoms that Mr. Mark is showing of Horner's syndrome, and this letter would be requesting his assessment and management from the reader. So you're preparing the reader in advance that this is what is going to be sought in the letter. So you're signposting of introducing the patient and beginning the letter gives a lot of clarity to the reader. If such signposts are used in the beginning, clarify what the letter is going to be about. Then comes the second category of sequential signposts. What are these? These are usually used to indicate when a particular action happened, or these help you in specifying the timeline of events that have happened in the patient's life. In the letters that you might have written by now, if in many cases you must have seen that there are multiple visits from the patient, and there are specific actions that have happened in those visits. The actions involve, let's say, assessment, prescription of medication, the patient complaining of signs and symptoms, or in other cases, if the patient is presented because of certain illness, when that illness happened, or probably if a patient has a condition from the past, so since when the condition started. So, in order to specify all of that, the timeline on how the events have happened, what happened when, to give clarity about that, we use the sequential signs. Examples: initially, at that time, at the time of admission can also be one. Firstly, secondly, lastly, following this, subsequently, recently, since then. Let's put this into a sentence and try. So you must have been writing about, let's say, the patient's admission or the first visit. So you could probably write: initially, he complained of breathlessness, but now his breathing is normal. So you're specifying that first the problem was with breathing, but now it has normalized. So the words like initially and now, they help to tell the reader when there was a problem of breathing and when there was no problem of breathing. So in order to specify that, we use these sequential signposts. Then we have additive signposts. Let's understand what are these. Many a times you have a lot of information to be given to the reader about similar ideas. And we do make lists to add those similar ideas, but sometimes the information is such that you have to put it into different sentences or different independent clauses. In such cases, to add further information or to join similar ideas, we use additive signposts. The examples of these are additionally, in addition, also. I want you to note one very important thing related to also. Also is not to be used to begin a sentence. For example, also she was commenced on medication. This would be wrong. You can put it in the sentence, but not begin the sentence with it. For example, if you say she was also commenced on medication, then the use of also is acceptable. But also she was commenced on medication, beginning the sentence with it, it's not acceptable. So how do we use additive signposts in a letter? Let's take this commencement of medication. So let's say if you're talking about the treatment that was provided to the patient in the hospital, and you want to talk about medications as well as other treatment options that were provided. So you could very easily write, she was commenced on antibiotics and analgesics. So in one sentence, you're writing about the medication and you want to give further information about the treatment. Additionally, physiotherapy sessions were commenced. So what are you doing? In both the sentences, you're giving the information about similar ideas, the treatment that was provided to the patient, but you want to add, you cannot put them into one sentence because it's not the same treatment. It's not medicines that were provided. So you're adding similar ideas with the help of the additive signpost additionally. Moving on to the next category, that is shift in topic. So when you move from one topic to another, because you talk about various aspects of the patient's life in your letter, you just don't write about one particular thing. So if you're writing about various things that have happened in the patient's life, so you do make different sentences for it, and there are various topics that you write about, and there cannot be a random shift. Let's say if you're talking about the lifestyle habits of the patient, you cannot just randomly jump on to what happened in the hospital for the patient. In such cases, what do? You use a topic shift signpost to indicate a change in topic or the focus of your writing. For example, in the context of his lifestyle habits, his dietary habits, regarding regarding his medical history, her social history, in regards to, just like we use in context of, in regards to her social history. And how do we put them into a sentence? Let's listen to this example. So let's say in a paragraph, you're writing about the history of the patient, whatever happened before the patient was admitted in the hospital. So in that paragraph, you're writing about various aspects of the patient's history. So you start by writing the medical history, and in the same paragraph, you want to shift on to writing about the lifestyle habits of the patient. So you can signpost the sentence by writing in context of his lifestyle habits. He has been drinking 30, he has been drinking 30 regular drinks in a week for the last 3 years. So you're giving the information that the patient has been performing this action for the last 3 years, but this is a lifestyle habit. This is not the medical history of the patient. It's not a medical condition. So from medical condition, you're shifting to the lifestyle habits by signposting the paragraph with a topic shift signpost. Finally, on this page, we have the the category of contrastive signposts. What are these? Now, it's not always in your case note, in your letter, do you give similar ideas to the reader. Many a times, you give contrastive ideas. You talk about one topic, and then you move on to a topic which is in contrast to that topic. In such cases, what do? We use contrastive signposts, and these are used to introduce contrasting ideas. Examples are, however, in contrast, and then although. Again, Geeta, I would request you to please not mark on my case notes. Thank you. Right. So just a second. Sorry for the interruption. Right. Contrastive signposts. Examples, however, in contrast, although is a subordinating conjunction. It is used in complex sentences. Whenever you're joining one independent and a dependent clause, you begin the dependent clause with although. Let's put one of these into a sentence. Let's say she was commenced on medication. However, due to her non-compliance, her condition did not improve. So we're giving the information that the medication was commenced, but she did not take it, and that's the reason her condition did not improve. So medication was prescribed, but she did not take it, or the condition did not improve. These are in contrast to the information that we have given that she was commenced on medication. So these are the categories of some commonly used signposts. There are others which I'll show on the next page. Now, if there be confusion in any of these, you do not have to worry. We are going to practice all of these a lot in the coming tasks, so it will give you a lot of clarity. Let's move on to the next page to learn more about some of the commonly used signposts in OET writing. We looked at 5 categories on the previous slide. We have 3 more here. Let's learn about them. Cause and effect signposts. What are these? In your letters, you must have observed, due to a particular action of the patient, there must be some result that they see. Or due to a particular action that was taken in the hospital, there is some, let's say, improvement in the condition of the patient that's seen. So many a times you have cause and effect situations in your letter. So when one action happens because of another action, we call it cause and effect. We use cause and effect signposts in order to indicate that this is the result of a particular action. So to show correlation, we use these signposts. Examples are therefore, consequently, since. Since is used for reason. Since is also we already saw that since then was already used as a connector, as a signpost for sequential ideas being provided. Since in particular, when you're using it for reason, is also used in order to show cause and effect. Let's look at an example using since. Since she adhered to the prescribed medication, her condition has improved significantly. So I'm using since here for the reason. So for the reason. This is the reason why the condition improved, because the patient showed adherence to the prescribed medication. So these are to show cause and effect relationship in the ideas that you present. The next category is to emphasize something in the letter. Many a times you must have observed that you want the recipient's attention to be drawn to a particular piece of information. These are especially used when you're talking about an appointment of the patient, a follow-up of the patient. So in such cases, you can use emphasis signposts. Worthy to note, please note significantly. For example, please note her Mr. Marks. We were talking about Mr. Mark earlier, so he's come up again. Please note, Mr. Mark's follow-up appointment is scheduled on 20th of April, 2000, let's say 23, at our facility. So you're specifying, you're drawing the recipient's attention to this date and action that's going to happen on that particular date. That is the follow-up appointment. And finally, we have conclusive signposts. When you want to conclude an action based on the details that have been given. Many times you write many actions that have happened, because of which you would be requesting something from the recipient. In such cases, you can use given the above or I would greatly appreciate. I would want to highlight something here, that given the above is to be not used randomly. OET prohibits the use of random use of given the above. It can be used when you're concluding that because of particular action, something is being requested. For example, in the preceding 3 paragraphs of your letter, you give the information about all the signs and symptoms that the patient showed, the prescription of medication that did not work for the patient. And then if you write that because of all these details, you are requesting, let's say, for assessment and management, in such cases, you can write, given the above, I believe a specialist intervention is needed at this point. So you're requested to assess, examine, and treat the patient. So just random use of given the above in every paragraph or the final paragraph of your letter is not acceptable. If there are actions because of which you're using it and requesting something from the recipient, in that case, it does make sense. So these are the 8 categories of commonly used signposts in your writing, and you can all use them, but be very wise in using them. Overuse of signposts, incorrect use of signposts is discouraged. I would not suggest that you do that. Now let's learn more about these through some activities. I know I've given you a lot of information, all of it together, and it becomes a little difficult to comprehend. But we're doing activities so that it becomes very easy to comprehend. So on your screen, you would now see a context statement, which says, your aim is to convey that Mr. Robson has been to the clinic before, and his visit on 23rd of September 2022 wasn't his first, nor it is his most recent visit. And the options that you have for the signposts are first, last, and subsequent. And now you have the sentence on your screen. On his dash visit on 23rd, Mr. Robson reported a mild impairment in his speech. Fill in the blank with any of the options. First, last, subsequent. Let me see the chat box. Okay. First, subsequent, subsequent, first, last, subsequent, first, okay, first. Read the statement again. I would request all of you, for all those who are a little confused, to read the statement. Your aim is to convey that Mr. Robson has been to the clinic before, and his visit on 23rd wasn't his first, nor was it his last or the most recent visit. Nor the first, nor the last. Neither the first nor the last. Okay. I see some of you changing your answers from first to subsequent. Last. Okay, last. Subsequent. Okay, Alpa. Gita says last. Swati says subsequent. Pooja says subsequent. Imtiaz subsequent. Raman subsequent. Sweetie subsequent. I think most of you got it correct. It is subsequent. Why will it be subsequent? Subsequent means after the first one, or let's say after the first, second, and third one. But subsequent means it's not the first, later on. It's the later on. And why can't it be last? It cannot be last because it's very clearly mentioned in the statement that it's not the most recent visit that you're talking about. It's neither the first one nor the most recent. So if it's not the first and not the most recent, which would it be? It would be subsequent. Great. Absolutely. Very good, all of you. Lovely responses. Now, this was an example of how to use sequential signposts. Let's learn more. Okay. Now, I have a paragraph in front of you. I would want you to take the role of a teacher and spot the incorrectly used signposts. The paragraph says, last week, Miss Lian presented with complaints of severe headaches, fever, and a runny nose. Additionally, she was prescribed antibiotics. Therefore, her symptoms were not relieved. There are 3 signposts used here. One is a sequential signpost, then we have an additive, and then we have one for consequence. Find out which ones are incorrectly used. You don't have to write the correct one, just write the incorrect ones in the chat box. Okay. I see the chat box having some responses. Additionally, therefore, and additionally. Okay. Additionally, Sanjana and Renu and Swazi. There are 2 incorrectly used, not just one. I'll give you the hint. Well, if you're writing 1, there are 2 of them that are incorrect, not just one. Additionally, and therefore. Okay. Okay. Karan says additionally and therefore. Now I can see, yeah. Now you're all putting 2 responses. Last week and additionally. Okay. Additionally. Therefore. Okay. Additionally and therefore. Right. Harleen, Nancy, and Kuldeep say additionally and therefore. Okay. Right. Now all of you are sending 2 responses. Last week and additionally. Okay. Let's see the response. Let's see how many of you got it correct. Last week, Miss Lean reported severe headaches, fever, and a runny nose. She was prescribed antibiotics, but her symptoms did not improve. So last week was the correctly used connector here. Signpost here, but additionally and therefore were incorrect. Let's go back to the example and let's find out why additionally and therefore were incorrect. Remember, we talked about additive signposts that are used to add information. In this case, the first sentence talks about the symptoms that Miss Lian presented with, that are the complaints of severe headaches, fever, and runny nose. And the second sentence talks about she was prescribed antibiotics. The second sentence does not talk about the symptoms that the patient had. It's only the first sentence that talks about it. The second sentence talks about the action that was taken because of the patient's symptoms. So it is not adding information. So if you're not adding information, we cannot use an additive signpost. The third sentence, let's find out why therefore is wrong. So if medicines are prescribed, usually what happens, there is improvement in the condition. But we are seeing that the symptoms were not relieved. So if the symptoms are not relieved, that is something in contrast rather than in consequence. So if something is in contrast, we better be using a contrastive signpost or a contrastive conjunction. So in the response, we've used a contrastive conjunction, but you can also use a contrastive signpost here. That would also be fine. But therefore, and additionally, that is a signpost for adding information and a signpost for consequence would be wrong in this paragraph. And I see most of you got it correct. So all of you have become pro at using signposts is what I see now. Moving on to the next activity. Let's see if we can learn about contrastive signposts as well. So you have a situation here in which there is a letter recommending a patient for further assessment and management. Identify the point or points in the letter where a contrastive signpost would highlight a difference or a change in the direction of the provided information. Add the appropriate signpost wherever necessary. Now, in this paragraph, you have the information about Miss Swift. There are many sentences and many ideas presented here. So I would want you to first read the paragraph and then I'll give the further instruction. So 30 seconds for all of you to read the paragraph. Please go ahead and read it. I'm writing to refer Ms. Swift for neurological assessment and management of her cognitive symptoms. Over the past few months, Ms. Swift has been attending regular physiotherapy sessions, which have contributed to a significant improvement in her motor skills and coordination. There have been persistent concerns about her cognitive functions. Short-term memory lapses have been a recurrent complaint, and despite rigorous assessments, the root cause remains elusive. Okay, I stopped the timer. I hope we have all read the paragraph. Now, at which point in this paragraph do you think there is a shift and a contrastive situation is being provided? So, whatever be the first word of the sentence where you think there's a contrast, for example, if I think that from here there's a contrast, I'll say over. I'll write the word over. Similarly, whichever part here you think is going to present a contrastive information, as is beginning a contrastive information, write the first word of that sentence in the chat box. From whichever part you think that there should be a signpost used for contrast, you can write the first word in the chat box. Let's say if I think that I want to use a contrastive statement here, a signpost here after symptoms. So I'll write the first word over. Similarly, whichever part of the paragraph you think there's a contrastive signpost necessary, write the first word of the sentence. Over the past, according to Dr. Imtiaz. No, I don't want you to write the connector. I want you to write the sorry. The first word of the sentence where you want to put the connector. Short term, okay. Short term, okay. The part where you want to put over the years in the past, okay. Where is there a shift of idea? Find out something where there is positive and then from there something negative begins. Yeah, despite already is a sign, I mean conjunction that's used in order to show a contrast. Apart from it, if you can find anything else, there, very good, Pooja. Short term, okay. There have been Triveni. Gurjot says there, okay. Neha says short term, okay. All right. So let's look at it. First sentence mentions what is required, neurological assessment and management for cognitive symptoms. Second sentence talks about the physical ability and the improvement in motor skills and coordination and the physical ability. The next sentence talks about problems related to cognitive functions and the examples of those problems. Short-term memory lapses are recurrent and the assessment could not identify what could be the reason because of it. So, where is there, in which part of the paragraph are they talking about improvement in this sentence over the past few months? While they're talking about no improvement or problems related to the cognitive functions in this sentence. So the second sentence over the past few months talks about something positive, improvement. While the third sentence, there have been persistent concerns about her cognitive functions. talks about something that's problematic, something that has not shown improvement. So where do we find the contrast? We find it here. There have been persistent concerns is from where a contrastive situation begins. Now, in the chat box, you can all put the signpost that you want to use. So over the past few months, Miss Swift has been attending regular physiotherapy sessions. Just a second. Yeah, over the past few months, Miss Swift has been attending regular physiotherapy sessions, which have contributed to a significant improvement in her motor skills and coordination. And you need to put a signpost here. There have been persistent concerns about her cognitive functions. Let's see which signpost people are using. However, very good. Adonai, Neha, Gurjot, Dr. Imtiaz, Kayumba, Dr. Yalpa, however, great. Pooja says, however, Harpreet says, however, absolutely correct. We can use however very freely here. So, however, there have been persistent concerns about her cognitive functions. It's absolutely correct and can very much be used. Great. Let's look at the answer. Oh, yes, in the answer we do have however. So, yes, there is a shift in idea and the idea is of contrast. So, the signpost, however, has been used. Great. Let's learn some more about additive and emphasizing signposts. Again, you have a paragraph here. You will have to identify in this letter where an additive signpost would enhance the flow of ideas and where a signpost of emphasis would draw recipients' attention. So you will have to identify two places. At one place, you will have to add additive signpost. At the other place, you will have to add an emphasis signpost. So first, let's talk about the additive signpost. Let's read the paragraph. It says, as a part of continuity of care, it is essential that Ms. Singh is closely monitored for any residual symptoms or potential complications. It is recommended to assess her medication adherence, specifically amoxicillin, and adjust the dosing as necessary based on how she responds to the treatment. A follow-up appointment has been scheduled after 2 weeks to evaluate her condition. Now, in this paragraph, where do you think you're giving additional information or where you're giving information about similar ideas? Write the first word of sentence there, of that sentence there in the chat box. It is recommended. It is recommended, right? It. Absolutely. Kuldeep says it. Dr. Yalpa, it is. It is recommended. Jatinder, it is recommended. It is recommended. It is recommended. Wachupu, it is recommended. Atanai, it is recommended. Uzma, it is recommended. Sarika says it's recommended. Great. Absolutely. So it is recommended to assess her medication adherence. Let's see. It is essential is the first part. So what is needed for the patient is that Miss Singh is closely monitored for any residual symptoms or potential complications. This is the first requirement of the patient. The second requirement is the assessment of her medication adherence. This is something else that the patient requires. So absolutely, before it is recommended, we need an additive signpost. And what additive signpost are you going to use here? Can you put that in the chat box? We talked about some of them. Which one are you going to use here? Okay. Additionally, in addition, okay, additionally, okay. Great. Yeah, we can absolutely use additionally here. Additionally, it is recommended to assess her medication adherence, specifically amoxicillin. Makes sense. Now, I want all of you to find out which is the part where you want to draw the recipient's attention and probably use, where we can use a signpost of emphasis. Which sentence do you think can begin with a signpost of, okay, Kujot says follow-up appointment. Okay. follow-up appointment, Taran. Pooja, follow-up appointment. I'm not looking for the signpost. I'm looking for the part where you want to put the signpost. Great. Follow-up. Right. Because we want to draw the recipient's attention to a particular action about an appointment that's going to happen in 2 weeks. Right. Great. Adonai also says that. WhatsApp as well. Lovely. And what signpost are you going to use? We discussed around 2 to 3 of them in the table. Please note, worthy to note. Great. Gujot says, please note. Tal says, worthy to note. Harleen says, please note. Pooja as well. Please note. Right. Dr. Yalpa, Bwachapo, Neelam, Uzma, Geeta. Great. Sweetie, Neeti. Right. Absolutely. We can write, please note or worthy to note, a follow-up appointment has been scheduled. Let's see if we are correct. Okay. Let's go here. Right. As a part of continuity of care, it's essential that missing is closely monitored for any residual symptoms or potential complications. Additionally, it is recommended to assess her medication adherence, specifically amoxicillin, and adjust the dosing as necessary based on how she responds to the treatment. Worthy to note, a follow-up appointment has been scheduled after 2 weeks to evaluate her condition. This is one way of putting it. Another way is that, as some of you gave the examples of please note, another signpost that's used here is also. So if you see also is not beginning the sentence, unlike additionally is beginning the sentence while also is in the sentence. So it is also recommended to assess her medication adherence. And just like worthy to note, you can use please note as well. Great. You are all writing great responses. All of you getting the correct responses. That makes me very happy. Lovely job done, everyone. Just a second. Moving on to the next activity. On your screen, you have a letter. This letter is about the patient, Mr. Tej Singh Randhawa. First, I would want all of you to read the letter and then find out how this letter can be improved in the introduction as well as in the request statement. So otherwise, the letter seems okay. There are many signposts used, but the introduction, the beginning, setting of the context is a little, I mean, it's not very great. Similarly, the request that is being made at the end is also not quite clear. So how would you add precision to the introduction as well as the final paragraph is what you will have to identify. We learned the statements for both of these in the table. Think about it and then decide. So you will have to just write the statement for the introduction and the statement for the final paragraph in the chat box. There is no hurry. Take your time, read carefully, and then identify. You will have to enhance the introduction as well as the final paragraph. When you have read the letter, think of a statement, a introductory statement, an introductory signpost that we learned that can be used to begin the paragraph stating the purpose, and think of a conclusive signpost that can help us in ending the letter. Okay, I see the responses coming in the chat box. Ma'am, one is the introductory, and the second one, Taran, is the final, the request paragraph. I mean, the statement in which the request is mentioned. Please assess, examine, and treat Mr. Randhawa as deemed appropriate. How can you enhance both of these? Okay, let's start with the first one, the introductory one. What statement do you think can be put there in order to set the context? Neha says, I am writing to request assessment and management for Mr. Randhawa. Good. Dr. Yalba says, the purpose of the letter, yeah, please complete it, what it would be. Right. Taran says, I'm writing, yes, I'm writing to request assessment and management since the signs and symptoms are being indicated. Absolutely correct. And I am writing, okay. Kayumba says, I'm writing to refer Mr. Randhawa for assessment and management. Great. He's presenting with signs and symptoms. Makes sense. Pooja says, I'm writing to request further evaluation and treatment for Mr. Randhawa, and then who is showing signs and symptoms. Makes sense. Vachapu says, I'm writing this letter to request further assessment and management. Makes sense, Vachapu. Now think of a statement or a conclusive signpost, not the statement. You don't have to write the complete statement. The conclusive signpost that can be used to start the last statement. Please assess. Sorry. I'm writing to refer is fine, Dr. Imtiaz, for the first introductory paragraph. I'm writing in regards to Mr. Randhawa Kita for the beginning is absolutely fine. Yes, Akash, again, for the beginning, these are absolutely fine. Dr. Yalpa says, yes, the purpose of this letter is to request. Absolutely correct. These are setting the context on what the paragraph is going to be about. So clear, quite clear. Think of the last one as well. Do you want to use a conclusive statement for the last, a conclusive signpost for the last one? Uh-huh. Given the above, yeah, it can be, because in this case, the progression of symptoms helps in identifying why given the above would be suitable, correct? Given the above says Neha as well. Given the above, right, Dr. Alba? Yes, Dr. Imtiaz. Yeah, it would be greatly appreciated if you could please, that is also fine. It would be appreciated, is absolutely fine, Taran. Given the above, it would be appreciated. These are all absolutely fine. Great responses coming from all of you. Great, good. Swazi also says, given the above. Okay, then let's look at the response and see if we are correct. We absolutely are. So, in order to add clarity and to set the context of the information being provided, the purpose of this letter is to request assessment and further management of Mr. Randhawa, who is presenting with signs and symptoms consistent with Horner syndrome. Given the above, it would be greatly appreciated if you could assess, examine, and treat Mr. Randhawa as deemed appropriate. Amazing. Great. I know I've put you into a lot of hard work, but I hope all of this is clarifying the user signpost for you. One final activity, and it would be on your screen. let's dive further into the discovery of signposts. There are two extra signposts used in this paragraph. Identify the extra signposts that are used. Let's read the paragraph. On his first visit, Mr. Zen reported of coughing up, red-colored sputum, wheezing, and disturbed sleep. Worthy to note, he presented with his wife. However, he requested for medicines for quick relief. Find out two extra signposts that are used here, which are not required. I can see responses coming in, worthy to note and however, right, worthy to note. Therefore is not used here. It's however that's used here. However, worthy to note and however, great. Worthy to note and however. However, oh, you don't have to seek apology, not at all. Worthy to note and however. However, and worthy to note. Okay. All right. Sorry. All of you've got the correct responses. It is worthy to note and however, both of these are extra because first visit does clarify when the patient first presented. It's not incorrectly used. But additionally, he presented with his wife, or worthy to note he presented with his wife, is not serving the purpose. We are not drawing the attention towards the wife. So worthy to note and additionally both would be wrong here. And however, he requested for medicines. That's got nothing to do with the wife. It's not in contrast to the wife. So, however, is again, contrasting information is not being presented. So we should absolutely have not used it. So how this paragraph can be written? On his first visit, Mr. Zen reported of coughing up red-colored sputum, wheezing, and disturbed sleep. At that time, his wife accompanied him, and he requested for immediate release. So we are not adding contrasting ideas. So, however, is removed. Okay, I hope that this session brought a little clarity in your understanding of the use of signposts so that your understanding of signposting can bring about clarity in your letters and help in readers' understanding and comprehension of the information that you provide. Thank you for being so patient. The resources that I've used in today's class are Khaira Education's own material. So you can visit the website and get access to the material that I've used in class. And to this link will also take you to some extra resources that our website has related to the topic of signposts and the topics related to other aspects of writing and other skills of listening, reading, and speaking. I have used some of the extracts from Gurleen Khaira's book, OET Writing Strategy Guide. So you can contact Khaira Education or buy it online. It's a very good resource to improve your writing. Thank you very much for attending this session. Again, Khaira Education is an all-stars provider, first premium preparation provider in Asia, and it offers a wide range of courses both in online and offline both. You can reach out to us and contact us through Instagram, Facebook, WhatsApp, or you can directly call us or go to our website and find contact details there. Thank you very much for attending the session. It was lovely having you in the class. Take care of yourselves, and I'll see you soon in the next session. Thank you.